Dr. Kishan Rees, who is a doctor within the NHS. Has this impacted your work in any way, and what are you hearing so far, Doctor? Good morning.
Good morning, Nick. Well, not impacted my work personally in terms of my medical work, but I'm fairly well briefed in terms of what's going on, because on Saturday I was outside the Royal London with Sky News, and we were just basically reporting, and the thing that came through was a prevailing sense of calm, and that is basically due to the healthcare professionals, doctors, nurses, yet again going the extra mile when we've kind of let politicians get on with their job of running the health service or kind of allocating funds so we can get on with what we've spent years training to do, which is treating patients. And I'd just like to apologise to patients who have had to wait and be delayed, because I heard a little bit in your package where I think it was the NHS England's incident director was saying people would have to wait longer. And just emphasise the fact that if you are sick, then please do attend and be patient, maybe come with patient notes, and just bear with us.
It's not very good. Well, I was just exploring with the computer expert. It's not a good situation that the computers and the systems are so old, Doctor, is it?
No, absolutely. I completely agree. And, you know, doctors, nurses have been spending years just making do the best that they can with the equipment that's provided to them. And traditionally, you know, in the NHS, doctors, nurses don't like kicking up a fuss and whistleblowing, so to speak, because people have had their careers ended as a result of it. Just have to look at Dr. Chris Day's case, lengthy legal battle. It's a real shame the amount of public funds that was spent on his case. If that went into IT infrastructure, who knows? I mean, it's easy to look back, but we may not be in this situation. I'm sure your viewers, your listeners are getting as bored with, you know, the NHS perpetually being in crisis. And hopefully this general election campaign will get a little bit more than just sound bites from all the major parties, because ultimately I think they're all equally to blame.
I think a lot of people would agree with that. Lastly, I note that in some instances, in some surgeries and some clinics, they're going back to using, just to get over the crisis, they're going back to using pen and paper. I mean, how long can that be sustained?
Well, I think it would surprise you, or why not surprise you, in the fact that doctors and nurses are using pen and paper, and it's something that we've had to cope with NHS IT systems that have been at times variable, shall we say. And, you know, some A&E departments in the country still use pen and paper as a primary method. Not many, to be fair. Most of them have gone on to computers now. But I think this is an issue that really needs to be sorted out, because as populations get more complex needs and the people get sicker, the amount of people involved in caring for those patients increases. So we really need decent communication networks between healthcare professionals to provide high quality and safe care.
Thank you for your time. Dr. Kishan Rees will be taking your calls on that.